There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what is the best medicine to take for hypertension? Answer by Amelie. As a healthcare attorney, I have reviewed well over 50,000 medical records over the course of my career. These included many patients who, like my mom, were suffering from complications from hypertension. I started to think about these cases along with those of friends and relatives whose quality of life was impacted by chronic diseases like hypertension. I wondered if they had anything in common. If there was a pattern I could find, I could provide some clues to prevent or better manage hypertension. Turns out, there was. It became apparent if many patients had known how to stay healthy or had their diseases been diagnosed and treated before symptoms occurred, they could have had much better treatment outcomes. Many who died could possibly still be with us today. I also noticed hypertension seemed to be a more frequent cause of premature death than other chronic diseases, especially among older women. According to the National Institutes of Health, NIH, hypertension is a public health challenge for everyone in the United States. Often referred to as the silent killer, hypertension can go undetected for years and show no signs or symptoms. You may have it and don't even know it. Even without symptoms, it can damage your heart, kidneys, blood vessels and cause loss of vision, memory loss, fluids in the lungs, angina and peripheral artery disease. Hypertension is not a man's disease. Approximately 30% or 1 in 3 American adults are diagnosed with hypertension, and by 2030 it is projected the incidence of hypertension will increase by more than 7%. Hypertension contributes to 1,000 deaths daily. The incidence in women increases with age and dramatically after the age of 60. Data from the National Health and Nutrition Examination Survey showed women over the age of 60 had a much higher incidence of hypertension than other adults, -65% compared to 32% or less in adults between ages 18 to 59. Given the statistics and my experience as a boomer woman, hypertension has now taken on a completely new meaning in my life. It is no longer a disease that significantly reduced the quality of life of many of my relatives or friends or took the life of my mom. It is a disease that now is likely to affect me. One I must be proactive about preventing and managing hypertension. I have reviewed many credible sources discussing how to prevent and manage hypertension. Typical advice includes eating a healthy diet, maintaining a healthy weight, getting enough physical activity and quitting smoking. These are all excellent suggestions to prevent or manage hypertension. However, here are a few more that have worked for me so far and kept my blood pressure within the normal levels without medication. Take charge of your health. Be an active partner with your doctor and other healthcare practitioners rather than a passive participant or observer when it comes to every aspect of your healthcare. Virtually all doctors agree working with an informed, engaged patient is always preferable to one that is not. Being a partner with your doctor will help you make better healthcare decisions as well. Be proactive about hypertension and your health. And remember, being proactive means more than getting an annual physical, taking vitamins, eating a healthy diet or exercising. It also means knowing what's going on with your body and making sure it gets what it needs to be at its best. Source: what every baby boomer needs to know about hypertension. I hope this will be helpful. Please read more health-related articles in our blog, Health Information and News, Proactive Health Labs blog, PH Labs. Answer by Patricia Nugent. Hypertension, also known as high blood pressure, has a ton of meds that can be used to treat it. That's the good news. The bad news is that there is no one best drug regimen for everybody. Doctors use age, sex, other health conditions, and even race to help choose what to start a hypertensive patient on. Doctors often switch drugs if you have bothersome side effects from one, and dose adjustments may also be needed based on your response. You should also know that most people with high blood pressure will end up on 2 or more drugs to control it, so keeping your appointments, telling the doctor about side effects, and taking medicines regularly and on schedule are all very important for the drugs to work safely. Monitor your own blood pressure between doctor visits. If you can, get a blood pressure cuff and keep records of these readings to show your doctor. This can help speed the process of finding the right drugs for you by being sure how well they're working. Or, some people like the free blood pressure checks that may be available at various places, like the drugstore, fire stations, or your jobs. It's also a good idea to talk with a doctor and/or nurse about what you can do to help reduce your blood pressure other than medicines. Some people can lose 10 pounds and have their blood pressure drop back into the normal range. Cutting sodium and mild moderate exercise can also help. Even if you end up still needing drugs, you might need fewer if you take good care of yourself. Things to watch out during treatment are drugs that interact with one another. For example, men who have prostate problems often take a drug to keep urine flowing, but the drug happens to also lower blood pressure. This can cause blood pressure to drop really low and cause fainting, which can be quite dangerous when driving or operating machinery. I've seen this one happen fairly often, and some blood pressure medicines interact with other drugs, so that one drug will raise or lower the level of the other drug in the blood. This can produce toxic effects if a drug level is increased or less effectiveness if a drug level is lowered. This becomes more important as people get older and end up on drugs for several different conditions, or if they take supplements or herbs. Newsflash: doctors don't always know about drug interactions like they should. The best way to prevent drug interactions is to go over all the drugs, herbs, and supplements you're taking with your pharmacist or chemist. Every time you add one, stop one, or change one, talk to them about any interactions that might happen and how to prevent harm to yourself. Answer by Ruchika Krishnan. My answer is puppies, and not just for hypertension, but for every other lifestyle disease out there. Reason: all lifestyle diseases like hypertension, diabetes type 2, depression, anxiety and so on have their roots in stress. If you are able to remove stress from your life, you automatically keep these conditions out of your life. Puppies, or any other pets, or friends, or hobbies, or sports, or any other activity that makes you happy will act as the best medicine for minimizing hypertension. Incorporate some stress-relieving activity and some physical activities in your life and keep on taking whatever medicine your doctor has prescribed. The medicine would be much more effective. I have covered how hypertension damages your body internally, how to prevent it naturally at home, and herbal medicine for high blood pressure in my blog article titled, How to Control High Blood Pressure Naturally at Home.